eat, you're in the right place. This is the Eatfluencer podcast, and I'm your host, Dr. Maggie Landes. Together, we are going to unpack everything about eating and discover the what, when, and how that will let you lead your best life. This is not your doctor's conversation about nutrition. Today is when you can start to love eating again. Let food be food and you be you. Get ready to get Eatfluenced. Hello, everyone, and welcome back to the Eatfluencer podcast. I'm Maggie Landes. I'm so glad you're here today. You are listening to episode 33, and welcome back if you're a regular listener, and warm welcome to anybody who's joining me as a first-time listener. I'm a board-certified physician and public health nutritionist, but as you know, I am now a diet culture disruptor, content creator, and wellness expert in the anti-diet space. And my whole purpose in life, personally and professionally, is to help people fix their food overwhelm, get rid of this obsession with chronic dieting, the pursuit of weight loss, and figure this whole thing out once and for all. And in the meantime, I want to undo the weight stigmatization that is poisoning our healthcare system. That's a little side project, but that's going to come in today. You're listening to episode 33. This is called A New Drug for Weight Stigma. And no, I'm not kidding, unfortunately. So first, I want to have a brief moment to share something with you before we get into the content for today's episode. I am starting a pro-to-pro private coaching / consultation program. If you are listening and you are an established health professional, and that may be a clinical professional, nutritionist, dietitian, fitness professional, trainer, health coach, any of those things, and you would like to find out information about how I can help you either craft content in a weight-inclusive anti-diet way, I can help you refine the branding, marketing, copy, content you already have for your clients so that we can serve our audiences in the most inclusive, most unbiased way. I have a program to do that. Or if you need advanced education, sort of the nuanced education that's a level above my signature getEATfluenced course, and that will enhance your ability to work in this space, I would like to hear from you. Please send me a message, an email, a direct message, whatever is the best way to get in touch with me. I will get you the information you need and have a chat with you about this. I'm not marketing this pro-to-pro program very heavily on my social media or on my website because I don't want to confuse my audience that really just needs sort of the basic education. But I just want you to know I'm available for that. If that is you and that speaks to you, please let me know. So let's talk about this weight stigma drug, all right? And I say that tongue-in-cheek like I always say everything, but I'm kidding, not kidding. And I have to be honest, this came from me watching the local news, which I realize is almost universally a mistake, unless you really like, 29 and a half minutes of completely biased, uninformative, poorly organized, and colored garbage headlines. But I will tell you, this morning I watched it, drinking my coffee, just waiting to get in the shower, and I'm kind of glad I did because this is a opportunity for me to help you become aware of how deeply impregnated our healthcare system, our scientific community that you rely on is steeped in fat phobia and this anti-fat, weight-biased narrative. All right, I'm going to use this particular example as an example of the bigger problem, but it's super relevant. Now, I want to let you know that I'm kind of putting a trigger warning out there. I am going to use the word obesity several times, and I am going to have a little bit of conversation about actual numerical weight values. And I say that because that's part of this conversation about this specific drug. I realize I have people in my audience listening that are in eating disorder recovery and various stages of sort of healing from this weight trauma. If you need to skip this episode or you need to skip those parts, that is fine. You are not going to hurt my feelings. Your healing is way more important than you hearing this tirade. But if you are comfortable with a few, what's the right word? Allusions to these concepts, then I want you to keep listening. All right? Because this is so relevant to the big picture. Now, the drug I'm talking about is the generic name is called semaglutide, which is marketed under several brand names that you have seen, I promise you, many commercials on TV for. It's already been approved by the FDA and by other regulatory agencies in other countries at a lower dose in use in diabetic patients. It increases insulin production and decreases cardiovascular risk for advanced diabetics that have a significant cardiovascular risk factors. Okay, so let me be totally clear here, because I don't need the PR reps from semaglutide calling me on the phone. I'm not talking right here about the use of this drug for cardiovascular event reduction. Okay, I'm not talking about what it's already approved for. Frankly, I'm not in that field. I'm not a cardiologist. I have not read and scrutinized a large amount of cardiology research. I'm not going to pretend that I have, and I'm not talking about that today. All right. So if your doctor has prescribed this, if you are a doctor prescribing this for that indication, that is not this conversation. Okay. Let me make that clear. What I'm talking about is this ongoing review that the FDA is conducting right now, where they are looking at a higher dose, a higher oral dose of this drug as a, quote, treatment of obesity, okay, end quote. And I realize that most of you don't read scientific literature. That's fine. You're not supposed to. If that's not your job, you're not supposed to. That's why I'm here. That's why other people are reading it, so that we can sort of translate it for you. So what it means is that it's not approved for that indication at this time, but the FDA is, looking at all the studies, particularly this is called the STEP trials, semaglutide treatment effect in people with obesity. That's the name of the trial. They're looking at this, and they have, the drug manufacturers have submitted this research to the regulatory bodies in the USA and in Europe so that they can try to get this approved and have it prescribed for that indication. Well, I don't have to explain to you what that means for the company producing the drug. All right, there's dollar signs filling the air because you can imagine the popular level of excitement and attention a, quote, obesity treatment drug would generate in the public. All right. Mostly, which is a result of the hysteria of this, quote, obesity epidemic that the healthcare providers have now put on the shoulders of their patients. But that's another podcast. So what I want to do is give you some very basic information about what data has been gathered about this drug and some basic information about how this would potentially affect the social narrative about weight and weight stigma. All right. And then use that as a example. I'm just using this as an example to show you that the science and literature and healthcare communities are not as clean and unbiased and unopinionated as you may perceive them to be. All right, that's the big picture here. That's the nutshell. So, first, I want to tell you that and this is where I'm going to say trigger warning here, all right, because I'm going to use some numbers. And if this is uncomfortable for you and you don't want me to talk about these, you don't want to hear me talk about these things, then you need to skip forward probably about 2 minutes, or you need to just close this episode. But the step trials that are being conducted to look at semaglutide as an anti-obesity medication. I have so many air quotes. My fingers are like tired of air quotes. I wish you could see me. The inclusion criteria. So what that means is what the subjects, what they had to have in order to be included in this study is a BMI of 30 or a BMI of 27 with a comorbidity. Okay, let me preface this whole thing. If you haven't listened to my BMI episode, you need to go back to whatever number it is. Let's see, I have my list right here. I better point you the right place. Episode 16 from January 20th. All right. That is the whole episode where I unpack the bogusness of the BMI and why, in my opinion, we should just totally eradicate that. But that being said, it is still widely accepted in the scientific literature as an inclusion criteria. So a BMI of 30, just so you know, or BMI of 27, we're talking about, just for a frame of reference, in case you're sort of not sure what that even means anymore, that's a person who's about 5'7", who weighs 175 pounds-ish, 175 to 180 pounds. Okay, that's who we're talking about including in this study. So I would argue that that is not the most marginalized, weight stigmatized group of people. Okay, somebody who's 5'7" and weighs 180 pounds is highly likely to fit into a booth at a restaurant. They are highly likely to be able to purchase clothes at a mainstream kind of retail store. Okay, they are highly likely to go to a doctor's visit or go to a fitness training session with a personal trainer and not be stigmatized because of their weight and not have the entire focus of the conversation relate to their body. Okay, so point being, I think this inclusion criteria is, not representative of the people in the public who are going to be craving this drug if it comes to market, who are going to be knocking on their doctor's door the day after it's released, who are going to be willing to look past all the warnings, all the side effects, all the black boxes in order to take this to get out of the place where they feel so uncomfortable in our own society. Okay, that's my point of saying that. I also want to make a point that the study protocols, at least as far as I have read them, there's 5 different step trials that are ongoing. 4 of them have been published, to my understanding, but all the groups received, quote, lifestyle intervention, okay, with their drug treatment. So they didn't elucidate exactly what that means, at least not the section I read. It is some combination of exercise, psychological support, nutrition education. I'm not sure what all that included, but it means that they didn't just swallow a pill. Okay, so you can see how this is going to run off the rails pretty quickly if this comes to market as a weight loss / quote obesity pill. Okay, because there's going to be hordes of people who are 5'7" and weigh 176 pounds running around asking for pills. Okay, that's what we're looking at. All right. And the problem is that where does the lifestyle intervention come in? Okay, because this study really is studying the combination of those two things. And we have so many problems with this quote lifestyle thing that are out of an individual's control. Okay. So yes, a person can choose to a degree how they move their body and what they eat. However, they can't do that if they are not even making a living wage and they're living in a food desert where they're buying groceries at Circle K. All right. They can't do that if they don't have health insurance because they're self-employed and they're cash pay for every single service they receive. And going to a dietitian may not be a choice for them. All right. It may not be possible if they don't have adequate childcare for them to go join a gym, work with a personal trainer. I mean, there's like so many social problems involved in just band-aiding everybody with this lifestyle intervention. I mean, you can really start to see how complex this problem is. You know, there are certain things that are in people's control, and I am all about putting the tools in their hands so that they are accountable for those things. But to turn a blind eye to all the things that are not in their control, I think is really challenging to kind of work around. Another problem I see, I would say problem, it's not a problem with the study, but you know, this drug is not without side effects. There is not a single drug in all of drugs that is without side effects, all right? It's just a matter of your risk tolerance, whether you want to take them, all right? Some of the side effects that have been noted in this drug in particular is GI side effects, diarrhea, stomach upset, things like that, which may be reduced if you slowly increase your dose, because the weight loss anti-obesity dose is 2.5 times the dose that is given for currently that's marketed for cardiovascular protection in diabetics. So I just want to make that clear to you. This is not the same dose. This is a 1.5 dose. There is a trend for some adverse bone changes, but it was reportedly not significant. And there's a black box warning for the risk of thyroid cancer, and this medication is completely contraindicated in people that have endocrine neoplasias and some other stuff. So all that to say, I don't want to get into the weeds of that, but this is not a risk-free undertaking. And not to mention, the study period that I saw was 68 weeks, which is, you know how long 68 weeks is. That's like not even 18 months. And the idea from the drug company is that we are going to use this drug as a, quote, chronic treatment for obesity, meaning that somebody could potentially be on this for years, for, I don't know, decades. I don't know how long. I mean, let's say you're, obese and you're 25 years old. I mean, are you going to take this drug for like 55, 65 years? I don't even understand. So where's the end point? We don't know. The answer is we don't know the end point. But I think we need to think about the end point before we jump into the deep end of the pool. But all this detail about the drug and the drug study and the boundaries of the study subjects and all this stuff is not why I'm here. What I am here to use this as an example for is really what was on the headline of my local news, and this is no kidding, what got me all riled up when I saw this, is that they said on the news, there is a significant association of psychological disorders and mental health diagnoses, including eating disorders, anxiety, and depression in people with obesity. Okay, I would say, yes, that's probably true. But here, the second part of their comment, this comes straight from the news, and approval of a medication like this that reduces obesity would fix all these problems, or reduce all these problems. They probably didn't say fix. What in the actual heck are we promoting here? Okay, so instead of addressing the systemic issues regarding access to healthcare, weight stigmatization, anti-fat bias, and all those public health problems, we are talking about prescribing a drug with fairly, I would say, significant side effect profile that may reduce weight in a population of people that are 5'7" and 175 pounds, who are probably not even the ones experiencing significant weight stigma in society. All right. So, the analogy to me, let me make this super simple. Okay. Let's say that there's like a malfunctioning train crossing arm. Okay. And somebody drives across the tracks and gets hit by the train. And then somebody else drives across the tracks and gets hit by the train. Well, here's our choice. We could, fix the train crossing arm. We could stop the train from coming. Or we could ignore all that and basically have extra ambulances parked near the train crossing so that when somebody is hit, there's like this fractional increased probability that the help will get there fast enough to save their life, and something catastrophic might not happen. But the chance of that is small, so we are really, truly, this is like spitting into the ocean. This is, having your entire house on fire, and, you have a Dixie cup of water that you toss at it. Like, this to me is just speaking to this whole social narrative that is my platform. This is what I want to do, is stop this conversation. I want to fix the train crossing arm. I want to slow down the train. All right. Because what we are doing with, potentially bringing a drug like this to market, in my opinion, is emphasizing and highlighting these things. The message that fat is bad, and that fat on your body is bad. It makes you unhealthy, and it makes you a bad person. We are emphasizing a message that you can take a pill and you might be able to avoid being fat, because ergo, number one, fat is bad and makes you a bad person. Whew, what a relief, right? We're advocating for this sort of quick fix, which is really only documented to be paired with lifestyle, quote, lifestyle interventions. But, really the research that I am aware of supports lifestyle interventions and their ability to improve health metrics, including glucose profile, blood pressure, blah, 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 blah. I can list them all. That's really boring. Even if weight loss does not occur, even if the body shape and size does not change. So let's talk about the lifestyle interventions. Like, I'm all about that. I'm not against that. Let's talk about that. Let's talk about getting some equitable access to people in food deserts. Let's talk about revamping our health education in the school system and the nutrition for school-age kids. And let's talk about stress reduction in the workplace and corporate health programs. Let's talk about lifestyle interventions. Okay, but let's not say that if you take a pill and stop being as fat, that either your health is going to be better or that your life is going to be better. All right, there is potential side effects to this. What we've only seen in these studies, is 68 weeks. And if we're talking about treating this like a chronic disease, which if you better bet your bottom dollar the drug companies are hoping we're going to do, because they want you to keep swallowing this pill and paying the money, what happens in the long term? Okay, are you going to just take this forever? What happens to the side effect profile when you've been on this drug for 5, 10, 20, 50 years? We don't know. What if you stop the drug? Or do you gain the weight back? Do the health problems come back? Do all these comorbidities come back? You know what? We don't have information to say that this really fixes the problem of poor health. So, you know, who's going to pay for this? Who's going to pay for this? If we say that there is a drug approved for weight loss, and every, trigger warning, 5'7", 175-pound person with body image issues is racing to the doctor's office in hordes to get this pill, somebody's paying for this. So it's either you paying straight out of your pocket or your insurance company's paying, which in the end means that we're all paying because, you know, you're not a surprise to you. The more that the insurance company has to pay out, the more the insurance company increases their premium so that they still make money. All right. Because they are not a charitable nonprofit organization. They are insurance companies. They are businesses and they have to make money. So, you know, eventually we're all paying to support this. Whether you swallow the pill or don't swallow the pill, you will be paying for it in the end. And I see so much wrong with this. Just how damaging this is to this conversation about obesity, this conversation about weight stigma. And let me be clear again, in case you missed the warning at the beginning, I'm not talking about a low dose use of this drug for cardiovascular protection in advanced diabetics. Frankly, I don't know about that. I have not read those studies. I have not studied the licensing for that. I'm not even talking about that. All right. So don't send me nasty emails saying that, you know, it was approved for all these things and it saved your great Aunt Franny's life and she hasn't had a stroke. I don't care about that. But I want you to be aware when you hear this kind of stuff, these drugs that are going to, quote, treat obesity, when you see the headlines, when you hear this news, this is like the worst possible game of telephone. Remember the telephone game where you whisper into the ear, they whisper into the ear, to the ear, to the ear, and then by the end of the line, it's like, doesn't even resemble the beginning. That's what happens here. And I want to expose this for those of you who maybe are not in the health sector, who don't realize how this kind of stuff happens. This is not as squeaky clean and perfect as you hope for it to be, or that you might wish that it were to be. But designing a research study and getting funding is a big, big, big deal. All right. And that is a biased process at the get-go. What ends up getting published once studies are conducted and where those results are published is also a complicated and not unbiased procedure. All right. Now, what happens when a whole study is published that has the details of the methods and the mathematical calculations and all this stuff? Ain't nobody want to read that stuff. So they take what's called the abstract. Okay, the abstract is like a very short, usually it's a couple hundred words, summarizes like the punchline of the study. All right, and it's not inaccurate. I mean, of course, they can't say anything in the abstract that they can't back up in the study, but the problem with the abstract is there's not detail. So you cannot be completely scrutinizing or completely supportive of a study design from an abstract. Okay, that's a critical mistake that so many people reading literature have. And I've been guilty of reading abstracts too. I don't want to read all these studies, but when it's important, I read the study because you can't just take like the heading. So now the abstract becomes representative of the science, which it is not the science. It is a cursory summary of the science. And mainstream media takes that, but even the abstract is still too nerdy and sciencey and high level because mainstream media has to be written at the engagement level of a 10-year-old or something, and it has to have the wow factor because, again, media is a business. There's competition. They want you to watch. They want you to listen. So they have to paint the abstract, which is a very blurry nutshell version of the science, which was already biased to start with. They have to put that wow factor on it and sort of modify the headline so that you will click and listen. Then, I mean, the next step, if this drug, comes to market, is marketing. And if you don't believe that there's bias in any other step of this process, a drug company selling you a drug is 99.9% invested in you buying their drug. That's it, period. It's a business. And I'm not saying if this drug gets approved for obesity or weight loss and you want to take it and you've had a conversation with your doctor, you are free to do so. All right? My point of this entire tirade is I want you to have an understanding that the information you are getting every step of the way is slanted, biased, colored by the diet culture messaging. That includes our scientific chain of research, discovery, publication, promotion. You're getting the message that fat is bad, that weight and health are synonyms, that your body weight is under your immediate control, and that you are morally obligated to attempt to control it. That is diet culture in a nutshell. That's when I say diet culture over and over and over. That's what I'm talking about, is that belief system. All right. So I'm going to end my rant here. All right. And I just wanted you to, see this example of this ongoing thing about this drug that's pending approval from the FDA for this obesity indication, air quotes. I want you to see nothing can escape the influence of diet culture and our social anti-fat bias. I could give you 100 more examples, but in the interest of time, I won't. What I want you to know is this: your body works and it wants to be healthy. All right, it works. Whether you believe in divine design, you believe in engineering, it has to work. It is a closed system. We just wouldn't survive any other way. All right. And there are ways you can learn about how your body works, what health actually means, and you can sort of leverage that to your advantage. Okay. Taking pills and having your stomach chopped in half, and all these other really outlandish, crazy quick fixes is not on that list. All right. You have the ability to take on health promoting behavior at any size. Health promoting behavior is good for you. Sleep is good. Stress reduction is good. Taking a look at what you're putting in your body, taking a look at your emotional health, taking a look at how you move and not being sedentary and stop smoking and all this sort of stuff. You can do that no matter what size you are. All right. I want you to also know, if you happen to be thin or you do all this crazy stuff and achieve this thinness, that doesn't guarantee health in any regard. All right. I'm not saying that you can't be thin and healthy. I'm saying that you're healthy not because you're thin. Okay. Get the difference? So let's just take the conversation about thin or not thin off the table. That's all I'm saying. That is all I'm saying. I'm not anti-health. I'm not anti-health promotion. I mean, trust me, this is my career. But what I'm saying is that they're not synonyms. You do not have a moral obligation to pursue weight loss, no matter what anybody tells you, including your doctor. If they want you to lose weight, why? I bet you 100% of the time it is because I'm worried about your health. Okay, what are you worried about my health? Let's talk. Let's be honest. What is it? Is it my blood pressure? Is it my liver function? Is it my joint health? Is it whatever it is? Have the conversation about that. You deserve to have the conversation about that without it always spiraling back to your body. All right. And I'm afraid that with drugs coming to market whose sole purpose is to make people not fat, we are going to be amplifying this conversation in the doctor's office rather than reducing it. And I'm extremely concerned about that. But I am here with a whole community of anti-diet advocates to help you. I want to help you. So if this is something you're interested in talking more about, please reach out to me if you are a professional, a health professional of any variety, and you're interested in my Pro to Pro coaching, consulting program. Let me know. And I appreciate you being here, as always, on the Eatfluencer podcast. I hope that you learned something today, and you will return more every Wednesday. I have a new episode, and we'll talk every week about this undieted approach to eating and health. So until next time. Thank you so much for being here today. If you love what you've learned, follow me on social media at Maggie Landes MD, and you'll never miss a thing. You can also check out my website at maggielandesmd.com and sign up to be part of our community of eaters. Thanks again for stopping by. We'll talk again soon.